Good afternoon, everyone. It's Dr. Galvin with another COVID update. A little bit different this time because this time I actually have COVID. So I think when I first started doing these videos about a year and a half ago, I kind of felt that at that point it was inevitable that I would probably get COVID. I've been exposed literally hundreds and hundreds and hundreds of times. What got me? My daughter. My immunized daughter traveled and must have gotten exposed to somebody, brought it back to the house and our office. And so over the weekend or so, she developed some symptoms and didn't think much about it. It was just cold symptoms, some congestion and other things. But then she lost her taste and smell. We had her tested. She was positive. We subsequently tested everybody in the office. Everybody was negative except for myself and my wife, and we spent some time with our daughter at the beginning of the weekend, and so we obviously got exposed. So what's been our experience with having a breakthrough COVID infection? Not much to write home about. My symptoms consisted of one day where I felt like I had the beginning of a cold, and I felt a little nasal congestion and maybe a little sinus pressure. I took a single Sudafed that day. The next day I woke up and the congestion was gone. I just had a little bit of sort of runny nose like you might get with mild allergies, and that was days ago. At this point, I'm fine. My wife had a little bit more severe symptoms. She had a little bit of body aches and more congestion and a tiny bit of cough, but again, 2 days worth, and she's fine. Neither one of us had any fevers, any respiratory issues at all. My daughter had 3 days worth of sort of cough, or rather nasal congestion and sinus pressure, and that's it. That contrasts to many of the people we've been seeing in the clinic and in the ER, which is a different story. And what we're seeing is a few breakthrough cases like I've got, and many, many other cases of people who are unimmunized. And those people are by and large pretty sick. I see a lot of COVID patients in the emergency department, but because of these videos and because I've got a lot of knowledge about it, I have a fair number of people that are coming to us in my clinic to be cared for COVID as well. And we've used a variety of protocols. There's a supplement protocol. I'll put the link up above if you guys want to request that supplement protocol, which we've been suggesting people use since the beginning of things to sort of boost your immune system. It's not going to cure COVID, but it may give you a little bit more of a barrier. And my idea of defense is defense in depth, and so do everything that might have a possible benefit. Get vaccinated, wear a mask, socially distance. If you're sick, stay home, wash your hands, eat well, be fit, make sure that you're sleeping enough, take supplements that are going to boost your immune system. All those things together add up to a pretty good screen and will keep you, if not getting sick, because Delta is very, very contagious. And if you get exposure, you're likely to get infected. But it may be the difference between having sniffles like I had versus a sudden cardiac death or a ICU admission, as we've seen in some of our patients recently. I've probably taken care of about 30 COVID patients in the last 7 days. Since a week ago Friday, I've probably taken care of 30. Of those 30 people, we have 2 of them that have been admitted to the hospital. The majority of them have been very sick, like sick enough to be in bed with bad flu symptoms. And that's despite using things like the IMAS protocol with the majority of these people. And everything else, the fact of the matter, if you're unimmunized and you get sick, a lot of these people are getting very, very sick. I know of 2 other breakthrough patients in our clinic. They called me just to tell me they didn't need any care. Both of them, one of them had no symptoms at all, and the other one had a scratchy throat and got tested because of an exposure. And that's pretty much what we're seeing. Most of the breakthrough cases are getting tested because they were exposed to somebody, not because they really have symptoms. So anyway, that's my experience. I've been pushing the vaccinations for, since they've been available. Now Pfizer is FDA approved. There's really no excuse. And if you look at our Facebook page, I've been posting accounts from friends and acquaintances of mine who are ER nurses, ER doctors, telling about the absolute chaos we're dealing with locally. Our systems in North Carolina and South Carolina are absolutely overwhelmed. We're looking at 12, 15-hour waits in the emergency department to get seen. That means that if you come in for a heart attack, there's no room for it. If you come in for a cardiac arrest or a motor vehicle accident, you might be getting seen in the hallway. If you have something less severe, like a kidney stone or nausea and vomiting or something like that, you might wait 12, 15 hours before you're seen. Our staff is stressed to the limit. They are working absolutely as hard as they can, and the patients just keep coming. And the one thing that is, the overwhelming theme of all of these sick COVID patients, and that's why the ERs are filled up, is because of sick COVID patients, is that 95% of them are unimmunized. And so the one thing you can do to protect yourself most effectively is get immunized. Realize that this Delta variant was not what the vaccines were developed for. It was developed for the Alpha, which was much less contagious. The good news is that they're still very effective against Delta. But you're much more likely to get infected from Delta than from the earlier versions because it's much more infectious. It's 3 to 6 times more infectious. If you get exposed, you are going to get sick. So if you don't want to get vaccinated, that's your choice, but just make sure that you socially isolate, you mask, you wear you wash your hands. Do not go out for dinner. Do not get into a crowd, because all it takes is one person inside to expose you and you're going to get sick. We want everybody to be safe. Put those layers up. Every extra layer is more protection. I want to give a little backup. I did do a TV broadcast on a show called Mouthwash, where we talked about COVID and my experiences. And I'm going to be on with Dr. Dan Stock, and we're going to have a little debate on Tuesday night at 9. So if you want to hear both sides of the story from a family medicine doctor and from an ER doctor with very diverging viewpoints about the virus, and probably honestly diverging actual real world experience with it, please tune in. I'll put some links on our Facebook page. For the YouTubers, I don't know if I can post the video I did with Mouthwash on YouTube, but they do have a YouTube channel. I'll try to link to that. And that is Tuesday night at 9 p.m. and it'll be live on Facebook. I will be back with more updates next week. I'll give you guys all an ER update. I'm cleared to go back to work Monday night where I'll be working an ER shift. That'll be my 10 days of quarantine, I guess. Anyway, I hope everybody stays safe. Wash your hands, wear a mask, get immunized, look after yourselves, your families, and everybody else, and I will be back with you soon. Stay safe.